Hi, I'm Emily.
And I'm Randy, and this is the Professions in Healthcare Lab. Right over here, we have all of our beds, our hospital beds where we practice. They adjust like a real hospital bed. We have mannequins that weigh just about as much as a normal person.
Over here we have a Sims. He's a automated mannequin.
You listen to take a blood pressure, take pulses. You can listen to and breathe, or heart right here. A CNA is a certified nurse's assistant. We do the bedside care. This class is an awesome opportunity because we are dual credited through Moberly. You can get a credit of intro to nursing. We do some anatomy and physiology. You can dual credit in medical terminology. And there's also microbiology and ethics of nursing. So those are all kind of incorporated into this class, so you're getting more than just your CNA. So this is the healthcare honors classroom. This is the type of classroom setting we are in a little over half the time. But the rest of the time we are either in the lab or at clinicals. Clinicals is our opportunity to do our hands-on learning at a nursing home. Basically, they give us the task list and we become the workers there for about 2 hours at a time.
I think the best thing is definitely the experience with going to clinicals. It definitely helps you figure out if you're going to want to go into nursing or not.
The interaction with the residents at the nursing home, they are really funny and you really get to bond with them over the time.
An RN, I want to get my bachelor's in nursing, and after that I'd like to be a CRNA, which is a certified registered nurse anesthetist. I just feel like this has really solidified my decision in going into healthcare.
In this class we did a lot of hands-on activities and we used real laboratory technology. We didn't just do quizzes and talk, we actually did the micropipetting, growing of bacteria, observing them, identifying what kind they are.
And this is an experiment we're doing right now, call it an ELISA. These are our lab books that we have to write all our procedures and data in.
Online virtual lab for an ELISA to get us prepared for the actual ELISA we're doing.
In lab explorations, I studied the effect of red light on Arabidopsis thaliana plants to try to find the function of a MAR2 mutation of these plants. And I observed the growth of these plants, how they responded to light and gravity, and also the color of the leaves of the plants.
Well, it's like a biochemistry technology class, which I find really interesting. I want to go into the School of Ag at Mizzou and major in biochemistry.
You learn a lot about biology and chemistry, like combined. I'm going to Wichita State University and I plan to major in biology.
I'm in the EMT class at the Career Center, and it stands for Emergency Medical Technician. It's like basically a training program so that when we graduate we can take a certification test and become EMTs ourselves. So I get to ride along an EMT in an ambulance and like watch how they do it, use like stretchers, and we actually got to do one day, we got to put a student on a stretcher and like tie him, like secure him into the board like we would a patient, and we carried him all the way around the school. Our instructor is a paramedic and he was also a firefighter, so he's really knowledgeable about things. So if you ever have a question to go to, it's a good class to take under him because he really knows his stuff.
Project Lead the Way is pretty committed to application-based learning. I never hear the question, why will I ever need to know this, or why does this apply to me?
Biomedical science program has been awesome. I've learned a lot. I've got to do way cool things I never thought I would be able to do in school. I'm actually planning on going to med school. I'm trying to either be an anesthesiologist or maybe some kind of surgeon.